You're watching BCTV, Brantford's community access station.
This is BCTV, Brantford Government Television, a service of Brantford Community Television. The following program is brought to you through the support of the Town of Brantford.
Thanks so much for joining us today as we discuss living options for seniors. My name is Pam Kirkby, and I'm on the board of the Shoreline Eldercare Alliance. Just a little bit of housekeeping. The restrooms are down the hall, and you've all been given surveys to fill out. We ask that you fill them out and leave them on the little table when you leave here. Some of you may be on our mailing list, but some of you may have heard about this from the newspapers or from a friend. So that's why we encourage you to fill these out with your contact information so that we can get our information to you. So, and also one other thing, I just want to ask if we can hold off on all the questions until after all of the panelists speak, and there will be plenty of time to answer questions. So today's presentation is brought to you by the Shoreline Eldercare Alliance, but the host is the Village at Mariners Point. And the Shoreline Eldercare Alliance, our acronym is C, and how appropriate that we are here on the C at the Village at Mariners Point. And we want to thank the Village for hosting the event and for providing the refreshments. So C is a nonprofit group of professionals who provide senior adults, their families, caregivers, and all of the community with education, resource referrals, quality professional services, and information about healthy aging. All of us here on the panel are active members and providers of the C Advocacy Group, and we strive to raise public awareness of issues important to all of you. We each have our own brochures from our organizations as well that you're invited to take, and then we have a C table is in the foyer for you to take when you leave for more information. So now I'd like to introduce our panel. First, we have Kathy Duncan, Reverse Mortgage Loan Officer with the Shoreline Division of Primary Residential Mortgage. Next, we have Molly Stanley, Community Liaison with Home Care Plus, previously VNA Community Health Care and Hospice. Rebecca Goodman-Olshansky, Marketing Manager of the Towers at Tower Lane. Kim Kelly-Rubin, Executive Director of the Village at Mariners Point. Debbie Artinian, Director of Community Relations at Artis Senior Living. Janet Waxlin, you're on yourself. Janet Waxlin, Registered Nurse and Administrator of ARC Healthcare and Rehabilitation at Brantford Hills. And last but not least, she's our founder and original mastermind of C, Bernadette DeJulian, Geriatric Care Manager. We also have with us today Steve Kujma, owner of the Shoreline Insurance and is the Shoreline's local life, health, long-term care, and Medicare specialist. And Steve's president of the board, and we have another board member, Vince Raganese of Downtown Medical Equipment in Brantford. So thanks everybody for being here. So searching for and understanding housing options and resources for seniors can be very overwhelming. If you go on the computer and you Google it, results, literally millions of results pop up for both national and state resources, and it can be very confusing. That's why we wanted to provide you with information from local experts in the senior housing industry. And while you have a top-notch group here, there are many other housing facilities and consultants not represented today that are within our network to whom we can refer you to. So please bear that in mind as well. before we dive in to hear from the panelists, I'd like to share a little bit about me. I'm a realtor with William Ravis Real Estate in Brantford, and I help all age groups buy, sell, and rent real estate. But I'm also a seniors real estate specialist. And you may ask, what is that? I've never heard of that. Well, I hadn't either. So I'd like to just tell you what got me here. And that is, a few years ago, I was working with a client who needed to sell her house. She was in her 80s and she had lost her husband. She had lived in this home for most of her life with her husband. And it was particularly hard for her because he was an architect and he also designed the house. So I came in and I helped her, I advised her. She had a lot of stuff. I'm sure you guys know what that's like. So I brought in an estate sales organization that was able to help her get packed up and even sold some of her items, and they also moved her. And then when we had the showings, I would be there all the time. I helped care for her beloved cat. You know, it was very special to her. And she didn't really like texting and using her cell phone, and she really didn't like to email, so I was always there in person with her. And when we sold the house, she went into what we call a CCRC, a Continuum of Care residential community. She went into Evergreen Woods. But because she had no kids and no close family members, she asked me to sit with her and navigate the process, navigate the contract, be her support system through this process. And I did that, and after she moved in, I went and checked on her to make sure she was happy and comfortable, and we've maintained communication ever since. I've stayed in touch with her. But the thing is, this was not, it didn't feel like extra work to me. I was honored. You know, I felt she trusted me, and that to me was so wonderful. And I realized there's really a need here. So I did some research and found out that the National Association of Realtors offered a seniors real estate specialist designation. So it was a 2-day course. I took it and took the exam and received the designation. And with that designation, I have resources. I've got website information, and I have access to an online database geared to specific needs of seniors. Some of that information gives me the education to keep current on news, events, legislative updates, and trends that affect seniors. I've supplemented that with my own research and network, especially my affiliation with the Shoreline Eldercare Alliance. I trust my fellow members with whom I often consult, as they give me more wealth of information than anything else. And this knowledge has helped me to become a more educated and experienced seniors real estate specialist. For all of my clients of all ages, I help people get organized. I give them the current value of their home and explain why, and help decide if it makes sense to sell. And if so, look high and low for the right place, and even if it's not listed yet or isn't even on the market yet. I just always keep an eye out for what people need. And keep in mind, I can also refer you to any place throughout the country and the world. But additionally, I write a column called Senior Scoop, and it appears in the Shoreline Times. And in fact, in this week's column, I wrote about the topic that we are here to discuss today: where will you live? One option is to just stay put in your home, and we call that aging in place. It's a good plan as long as it's safe and comfortable. You may need a stair lift or a wheelchair ramp grab bars in the bathrooms and showers, or other modifications. And we have resources to help with all of that. And as Bernadette pointed out to me, staying in your home should be influenced by social exposure, location, and ability to get to and from the grocery store, pharmacy, your doctors, etc. And Bernie will speak to that a bit later. But now, what if you want to keep your home and you're having trouble with your finances? Well, this brings me to our first panelist, Kathy Duncan. Kathy, how can you help?
So I am a reverse mortgage loan originator, and one of the way to pay for a new home or modifying your existing home is through a reverse mortgage. And when I was getting ready for this event, I too checked the Google, because I Google everything all the time, but I looked for the definition of reverse mortgage. And this is what came up from Oxford Languages, not the dictionary, but Languages. And I thought it kind of spelled it out pretty well. It's a financial agreement in which a homeowner relinquishes equity in their home in exchange for regular payments, typically to supplement retirement income. So one of the best features of a reverse mortgage is that no payments are required. So you have funds available to you, but you don't need to make payments on it. Unlike traditional mortgages, which decline as you pay down the loan, most of us are familiar with that, making monthly payments, you're paying principal and interest. Reverse mortgages actually rise over time as interest on the loan accrues. So while you're not paying the reverse mortgage, however much you've used, interest is accruing on what you have used, and that is making the loan grow. There are some requirements of a reverse mortgage. You must be 62 years old or older, although there are some products that actually are available for those that are 55 and up. You must own your home. This is not for renters, and it must be your primary residence. So you can own a vacation home or rental properties and still be eligible for a reverse mortgage, as long as we're talking about it on your primary residence. You must maintain your home in good condition. If the roof is leaking, you've got to get it fixed. If the paint is peeling, that's got to be addressed. So that's, I know I'm like blurting out a bunch of information all at once, but that's your basics of reverse mortgage. There's different ways that people can take funds from a reverse mortgage. So they can get a stream of income where they'll get the same monthly payment every month until they leave the home. So if you are putting reverse mortgage in place and you're 80 years old and you live to 125, there's a specific amount that's determined through an actuarial calculation that will be paid to you or direct deposited to your account every month until you leave the home, even if it's when you're 125. Additionally, another option is to take it as a line of credit. Most people have heard of a home equity line of credit, and many people have taken them. But as you age, they're harder and harder to qualify for because it's based on income. And but with a reverse mortgage line of credit, it operates just like the home equity line of credit, where you just take what you need, and that is what the portion that accrues the interest on it. And the rest of it sits there available for you to use at a later time. So if I haven't confused you enough yet, I will tell you that every reverse mortgage is different and needs to be considered individually. Just because your neighbor or friend has a reverse mortgage or doesn't have a reverse mortgage doesn't mean it won't work the same for you or won't work out better for you. But it's something worth considering and a conversation worth having if aging in place, aging in the home you're living in is important to you, or if you want to move to a new home so that you can age in place, something that's better suited for you. You can use a reverse mortgage to actually purchase a new home as well. There's lots and lots of different ways to use a reverse mortgage. will tell you a quick story. I'm doing okay on
You're
time?
doing okay, yes.
A quick story about Carol and Bill. Bill had an aggressive form of dementia, and Carol was finding it harder and harder to take care of him on her own. So he was going to adult daycare a couple of days a week, but his disease was progressing and he wasn't going to be, they weren't able to handle him there much longer. It was coming, the time had come that she needed to find a facility for him. At the very early onset of his diagnosis, they actually consulted with an estate planning attorney who helped them get their estate in order. The house was quitclaimed to Carol, and they talked about and made plans for the future. So together, when he could and had the ability, they made plans. Carol reached back out to the attorney as things were changing and asked for advice on what to do next. She would not be able to afford staying in her home and paying her bills when Bill goes into a facility. So the attorney suggested a reverse mortgage. So based on the attorney's suggestion, Carol put a reverse mortgage in place. She owned the $250,000 home and had a $120,000 line of credit through the reverse mortgage. Carol started investigating what to do next, and she visited different dementia care facilities on the shoreline and decided on one that was most convenient for her. Bill was admitted to that facility, and Carol paid out of her pocket for several months. He was on a spend down, so Bill was even on a Title 19 spend down. I don't know if anybody's familiar with that. I bet we'll get there. So
I don't know.
So with that, so Carol was spending their savings that were in Bill's name, along with Bill's Social Security and his pension. It all went to pay for his care at the facility where he went. So after Bill passed, Carol was just left with her own Social Security income, which increased a bit because of Bill's. And she also had a small pension of her own, which was enough, and that income was enough for her to live on her own. But she was going to have to spend her savings or use a reverse mortgage to pay her property taxes and other big bills. Like this year, the oil is crazy high and different things are just expensive. She needed a new roof. She needed this safeguard and this, she has a pot of money to use when she has a need. And so that is where Bill's passed. Carol lives still in the home. She can stay there for the remainder of her days as long as she wants to, because it's set up nicely for her, and she can age right in place there. So
That's great. Thank
Yeah.
you, Kathy.
absolutely.
So continuing with aging in place and staying in the home, Molly, can you speak about various options with home health care?
Sure. I'm just going to talk briefly about Medicare home care, what Medicare pays for and what it doesn't, and then private duty home care. A lot of times people get confused at those two different options. So for Medicare to pay for home care services, there has to be a skilled need. There has to be something that happened, whether it's a fall, a surgery, an episode that needs nursing, physical therapy, occupational therapy, maybe a home health aide. There has to be a doctor's order. So your doctor has to, and just to let you guys know, I have this all laid out in more specifics in this, so I'm just going to give a very brief overview. So there has to be a doctor's order, there has to be a skilled need, and you have to be homebound. Homebound status does not mean that you're bedbound. It means that it's very difficult and taxing to get out. You are allowed to go to doctor's appointments, to, believe it or not, go to the hairdresser. Yes, but you can't be having lunch every day at Pat's Country Kitchen with your friends, or going to the gym, or going to see your granddaughter. Medicare will not pay for these services if it's easy for you to get out and about. Then when that benefit kicks in, if the doctor says, yes, there's a need, it's very difficult and taxing for you to get out, I'm not going to get into all the insurances. You can talk to Steve about that. But if you have straight Medicare with a supplemental, typically it pays 100%. If you have managed Medicare, depending on what policy you go with, there could be copays. So whatever agency you decide to use, whatever, like if it's the VNA, there's several different agencies out there. It's important to ask them to have your insurance and ask them exactly if there will be a copay or there won't be a copay. And typically you get skilled nursing, physical therapy, occupational therapy, speech therapy if you need it, home health aid if you need it, social work if you need it. And your nurse case manager will discuss those options with you and talk about what your needs may be. This benefit is intermittent, and it's not a long-term solution if you need to stay in the home. I'm going to give you an example. If I'm sure many of us here have possibly had surgery for whatever reason, whether it's a joint surgery, heart surgery, some kind of surgery, or some kind of episode like a fall where maybe you broke something, and if you go to the hospital, you have your surgery, typically you'll get discharged from the hospital and go to a skilled nursing facility like Brantford Hills, which Janet will talk more about that, and then you come home. Upon coming home, getting discharged from a skilled nursing facility, or if you decide not to go to skilled nursing for short-term rehab and the hospital can make that referral, then the VNA nurse will come in. And they'll be with you depending on what your diagnosis is and depending on what your Medicare and your insurance policy covers. It might be 3 days a week of nursing, then physical therapy, but over time, as you get better, the services decrease. So as you get better, Medicare is going to slowly start not paying for that. It definitely is not a long-term solution if you need more help in the home. So that's just the gist of that. Again, I have all that laid out here in more details, and you can also ask questions at the end. Private duty, which we say private duty or custodial care, home care, is quite different. Insurance, Medicare does not pay for custodial care. And an example of custodial care or private duty is having a companion or a homemaker, having someone do light housekeeping for you, grocery shopping, meal preparation. Sometimes they'll help if the meds are already poured, just reminding you, reminders. Having someone sit with you or your loved one for an extended period of time. That's, again, called private duty or custodial care. Insurance does not pay for that. Long-term health care insurance can pay for it, but not your Medicare or your Blue Cross Blue Shield. If you have a long-term health care insurance policy, that's a whole other ballgame. But that, depending on what your activities, the daily living status, and other things, every policy is different, that could help pay for custodial care. There's also a program in the state of Connecticut called the Connecticut Home Care Program for Elders through the Agency on Aging. So in our area right here, the Agency on Aging is out of New Haven. It is based on income and assets. So again, that's a whole other realm, and there's several people here that, Bernadette in particular, that could, help answer those specific questions. But those are two options that could help pay. Otherwise, it really is private pay. It is out of pocket. Typically, private duty home care agencies are between $25 to $35 an hour, and most of them have a certain amount of hours per week requirement. Several places do live-in care where you can have a private duty live-in person live with you, or 12-hour care. Again, we work with a lot of private duty home care agencies and can send you to the experts on exactly what each agency does and how much they cost. Am I good with?
Yeah.
Again, very quick overview, but we can ask questions at the end.
Great, thanks, Molly. Yeah, so now if we move out of the home, what's kind of the next level of care? Rebecca, can you speak to that?
Sure, hi. I'm representing the Towers at Tower Lane in New Haven, and speaking on behalf of the affordable options that seniors have when moving out of your home. Nonprofit, the Towers, which it is, any retiring senior would prefer to pocket their life savings, but sometimes switching one's living situation can come with a hefty price. So, for instance, living at the Towers, we're a not-for-profit. Everyone has his or her own apartment. Okay, looking at senior housing, you want to make sure that it's something that you can afford, and make sure that the community has all supporting services that you might need in order to age, what we call age in community. All right. The Towers, we offer independent living imbued with purpose and meaning. Residents forge new friendships, engage unique programs, rediscover the joys of life. We offer various style apartments, from anywhere from studios to 1-bedroom and 2-bedroom apartments. What's unique is that monthly rates for your apartments can be significantly less than looking at the for-profit communities. Also, what is unique is as one's income, your income is basically stable. You're getting Social Security, possibly a pension, or an annuity, but as your assets start to deplete, you want to make sure that you're not going to have to pack up and leave again. So that differentiates subsidized housing and some market rate communities. What's unique about some of the not-for-profit communities is, for instance, the Towers, you don't have to leave because the market rate apartments compared to some of the for-profits are significantly less when it comes to a monthly rent. Also, what's unique is that some of your not-for-profit communities, like the Towers, participates in state-funded programs if you're income eligible, like Molly had said, for part of the Connecticut Home Care Program for the elderly, or even if you're on a spend down for Medicaid, can be a pay source for assisted living services. What also separates many of the not-for-profit and the for-profits is the supportive services that can be given with state-funded programs as well, different levels of care. Full-time social workers specialize in easing transitions to ensure that the best choices are made to match your needs. Just in general, when you begin to let go of work responsibilities and we care for our relatives, it's a little more difficult for some residents to make friends going into a new communities. We at the Towers have several approaches to help new residents make these life transitions and learn how to make the connections as you grow older. And the connections are facilitated by a series of life-enriching programs that we offer. It's a difficult choice at this point in one's life. No one likes change, truly. A little bit of my history, I've been with the Towers for 24 years, and I personally have had family members there for 50 years. The Towers has been in existence for 51 years. I'm including my mother. My mother lived there for 14 and a half years. She moved in at the age of 81, very active, knew a few people, made a lot of friends, but she was able to age in community. As her needs arose, they were right there for her. She didn't need to leave her apartment. As her assets depleted, she became income eligible for a state-funded program that helped to pay for those assisted living services. And she still had assets, so she could go freely to shop or go on a trip or things on that order. And as needs arose, those programs and services came to her. Unfortunately, she took ill, had a fall, and she couldn't return. even with 24-hour live-in, she needed to go on to long-term care, which, Janet will allude to as far as the next step if you can't live in your home with 24-hour live-in. It's important to really do your homework and think about where you are in life and where you want to be, and possibly leaving a legacy for your family if you do have some means, and that was your goal in life. So,
Thanks,
thank
Becky.
you.
So now, Kim, can you speak to what the village, well, assisted living really is?
So, my name is Kim Kelly Rubin, and I'm the executive director here at the Village at Mariners Point. I've been here for 8 years, and the Village at Mariners Point is one of 65 benchmark senior living communities here in the Northeast. So what we offer is an independent lifestyle with assistance, as well as a small private memory care. So we have 133 apartments here. 112 are dedicated to our traditional living residents, and 21 are dedicated to a small memory care neighborhood. We are considered an age-in-place community. That means many of our residents come to us. They don't need any type of assistance. It's just that they're tired of cutting their grass, they're tired of having to paint their house, take out the garbage, do a lot of things that take up a lot of time. So they come here and they live an independent lifestyle. Currently, our traditional residency is 118 residents. And of those 118 residents, 67 do not get any services other than their meals with us. So we do have a very independent community. You can bring your car here, you can come and go as you please. This is really senior housing, where if your health needs should change, or if they are changing already, you can make a decision to move to this community or any benchmark community, where you will have on-site 24/7 assistance here, where we have certified nursing assistants, we have LPNs, licensed practical nurses, and registered nurses as part of Benchmark's own team. So we offer assistance with your activities of daily living, whether you need assistance with getting dressed, getting showered. If you are not able to move, we have mobility that we will get you from point A to point B. Benchmark Senior Living does offer the highest level of care in a community, where we do even have mechanical lifts. So we can take care of somebody who is no longer able to get up on their own and have them live a very productive lifestyle here. We have a full-time programming director, a very active calendar. Our residents on every third Thursday, they are at Mohegan Sun. We don't have a bunch of gamblers living here, but there are some great restaurants and shops up at Mohegan Sun. And the programs are actually scheduled by our staff, by our residents. So they meet with our programming director, and we initiate all sorts of different activities that are pertinent to their lifestyle. 3 meals a day is included. We do not have full kitchens. That's what separates us from an independent living community. If you are looking for an independent living community, that is going to have a full kitchen. Often when you have an independent community with a full kitchen, you are not going to have any care staff there. You are going to have to hire outside service providers to come in and assist you. That will be on their schedule, not necessarily yours. Here in our community, your assistance is provided at your schedule. There is someone here 24/7 to give you a shower, whether you want it at 11 o'clock at night or at 6 o'clock in the morning. You're not going to be waiting for somebody to come in from outside who can't get here because there's a blizzard going on, or they had a sick child that day and they couldn't come to work. So the care is here for our residents, and that assistance is as you need it. So one of the things that we do participate in that not every assisted living community does is the Connecticut pilot program. So as you spend down your assets, the Connecticut Pilot Program can actually subsidize your stay here in the community by covering your costs for your assistance with your activities of daily living, as well as medication management. You would still be responsible to pay for the rent portion of your stay. There's also the veteran aid and attendance benefit that is also available to any veteran that has served during a time of war. So that is another subsidized opportunity for people. You can be the spouse of someone who served during a time of war as well and take advantage of that benefit. So, other than that, I'll take any questions at the end.
Thanks, Kim.
Thanks.
So I know you have a small area for dementia.
Yes.
Let's hear from Debbie, who works for residents that has, well, you take it away, Debbie.
I'll take it. Excuse me. So my name is Debbie Artinian. I am the Director of Community Relations at Artis Senior Living, and as Pam mentioned, that is all we do. We are a complete memory care community. We have 64 suites, and you know, it's really what we do. So I just first of all want to say I want to thank all of you for coming. It takes a lot to actually admit we're all getting older and we all have varying, needs. Things are going to change, as we all know. And I'm just, you should give yourselves a little pat on the back for being the person that actually shows up and gets educated, because in my work, I see a lot of people in crisis and not prepared. So good for you. This is a really great first step. So I want to do a little bit more education. I'm a teacher by trade. 100 years ago, well, maybe not 100 years ago, but a long time ago, I was a science teacher. And I really think it's important to be educated as to, what is ahead of us. So I actually was previously working at the Alzheimer's Association, and I'm going to say I feel like I'm a pretty educated person, and I had no idea what was going on in this country. I can't speak for the world, but at least in this country with dementia. So I just want to start with something that I was surprised about. Dementia is like the umbrella, and Alzheimer's is one of the types of dementia that falls under the umbrella. A lot of people think they're two different things, but they're not. So you have the big umbrella of dementia, and you have Alzheimer's, you have frontotemporal, you have Lewy body, you have vascular, and then a few other more rare types of dementia. So that's a really good piece of information for all of us. How do you know when it's time for memory care? As you can imagine, working in a memory care place, I hear all the jokes. I forgot my keys. Maybe you should get me a room. Oh, I forgot, to go to this appointment. Maybe you should get me a room, Deb. So I want to share with you that is not dementia. The most important thing to do is, and this is just this is just my opinion. I would say if you have concerns, there isn't any set test for dementia. If you're concerned about yourself or a loved one, you should go see an expert. That's my advice. Sometimes primary care physicians, and I'm not trying to throw anybody under the bus, aren't really fully educated. I'm going to tell you that I've had a few cases where people came in and they said, the primary care physician said they were fine. They were just getting old. And that was not the case. That was not the case. And some scary things happened, and thank God nothing tragic happened, but they did bring them in, we assessed them, and they moved in with us. So sometimes Alzheimer's Association is spending a lot of time and money on legislation and trying to, that surprised me. I was really surprised. Doctors are not trained on dementia, primary care doctors. So see a specialist, place like Adler or geriatric specialist, to really find out what's going on. So I'm going to share a personal story. I hope I don't cry. It's my own in my family. And I feel like this is something that I hear time and time again when folks come into Artis and tell us their stories. One of my family members started having some, call them symptoms. So, I had my cousin say, hey, she just forgot to pick up Katie today at school, because everybody knows where I work, right? So they're like, should we be concerned? And I was like, okay, did she forget one time? No, she forgot 3 times in the last month. She has never done that before. Okay, all right, we're concerned. And then when you talk to her, she would be like, oh, I thought it was Wednesday and it was Tuesday or whatever it was. So it's easy to kind of brush that and be like, oh, she just forgot. Then she started asking repeated questions at family events, and we were all starting to see it. And that's usually what happens. It's like you may not see that person, and then you're at a family event or vacation or something, and then all of a sudden you're all going like, okay, wow, are you seeing this too? Because now I'm seeing this too. And that's what happened. And so of course my family came to me and they were like, what should we do? And I said, go to Adler. If you're, there was a few other things that had happened. She put a roast in the oven and left. Thank God, somebody else was home, and so it wasn't a disaster or a tragedy. But all of those things together were concerning. I said, yeah, maybe the grandkids shouldn't be alone. I'm not saying something bad's going to happen, but let's be armed and prepared, and maybe just make sure there's always somebody else close by if she's watching the kids. I mean, the kids are 10, so they're not thank God, 8 months old or something. So she did go, and she did get an early Alzheimer's diagnosis. So she's still home, she's still doing her things. She literally went on a trip to Florida, which I was really stressed about. But again, because everybody knew, they took precautions. They made sure the airline, got her on the plane, and then there was somebody right there at the gate to pick her up, but not make her feel like she can no longer be an independent person, right? Because, none of us want to feel like that. So I have my little cheat cards here, hold on. So that is my story. And then I would say right now she's okay, but then what happens is dementia, it never is a straight line. It's not, everybody has the same kinds of experiences. Some people, it can start fast and progress fast. Some people it starts slow and progresses slow. No two are alike. So that's actually very challenging. So I'll hear people say, well, she remembers my name, but she's also feeding the cat her dinner and eating the cat's food. So we're going to say, let's assess her, because that doesn't seem like something we really want her to be experiencing, right? So sometimes we just try to fool ourselves. I found myself even doing it, when I said, well, she did ask me that question 3 times, but, maybe she just forgot, right? But that wasn't the case. And then once we all, got together, we were like, okay, let's just do it. Just go, get the test done. And if they say, you got no worries, then you got no worries, right? But that is the most definitive diagnosis you're going to get, is if you go to a center like Adler Center or see a geriatric specialist. So when folks come to us, they're usually in crisis. So that is the number one point I would like to make here, is if you are concerned, don't just push it aside. Just get a test done so that it doesn't mean, oh my God, right away they're going to have to go move into memory care. That's not the case. We actually assess folks and say they're not ready for artists. Maybe you need somebody to come and stay with them a few days a week, or maybe you need to get the family together and make a plan and help them out. She's just not ready for artists yet. So no memory care community is, well, I would hope, ever going to say, yeah, just move them in, because if they're not appropriate for the community, it's going to be a terrible experience for everybody, right? So I know a lot of people get nervous about that, oh, as soon as we come and see your community, you're just going to want her to move in. No. And nobody wants them to move in. None of us really want that to happen, right? And I know I have the worst job, right? Nobody really wants to come to a memory care community. But if you do, we're here for you. We will help educate you. We will support you. There is no, it's not pushy. This is not something you're trying to push somebody to do. You want to do it when it's the right time. And the right time is usually when the family can no longer make it happen. Lots of things that I don't really want to, drill down on, but a lot of things that can just be really overwhelming for a family. Once those things happen, that's usually when, I would say that 50% of who we have living with us, the families are just okay, once this started happening, we can't do this anymore. So we need some help, right? So don't wait till it's a crisis. Make sure you're educated. If you're concerned, find an expert. And, again, there is no definitive test, but there are 10 warning signs, and forgetting your keys is not one of them. So don't worry.
Thanks.
So thank you so much.
Thank you. we certainly don't want to wind up in memory care, but we also don't want to wind up in skilled nursing. However, Janet will educate us about that.
So hi, I'm Janet Watson. I'm the administrator of ARC Healthcare and Rehab at Branford Hills. We were recently acquired about 4 months ago, so it's the same great place, same great people, but just a new name. I'll talk about two aspects of a skilled nursing facility. The first one we touched upon already is when you're in the hospital and you go in for the hospital, say for pneumonia, cardiac surgery, a hip replacement, knee replacement, you may need to come into a skilled facility for some short-term rehab. So there's a misnomer that Medicare covers 100 days in a skilled facility. That was years past. You have to meet certain criteria for Medicare to cover your stay. So Medicare could be a payer of sorts for short-term rehab. Also, a lot of managed cares like United Healthcare, Aetna, Blue Cross Blue Shield, and Anthem. So that is one aspect of short-term rehab. The next is long-term care. So I don't think anyone ever said I wanted to sell my house and give up 3,000 square feet and go into a facility and live with a total stranger. Nursing homes are so much different than they were years ago. Nursing homes, people come to live. You don't come to die in a nursing home. I'm going to talk about 8 aspects of why I think you should come to a nursing facility when and if you need our facility. The first thing is you need help with your activities of daily living, and I know my co-partners here have already touched upon that, but that is your bathing, eating, dressing, toileting. That's called activities of daily living. Balanced stimulation. The nursing home assesses a patient and gets to learn the patient and knows how much stimulation they should have and what they shouldn't have. So there's that balance. There's also active socialization. So like I said, there's activities going on. People go on out trips. You can go home with your family. You can go on day trips, things like that. So it's not like you have to be in all the 4 walls each day. You're allowed to go out, and it's encouraged. I actually have one of my residents who volunteers at the Dan Cosgrove Animal Shelter here in Branford. She loves animals. I love dogs. I wish I can go there every day to be with the animals. That is something that she thrives on. So that is wonderful, and that is part of her life, and she continues with that, and that's just thriving. The next thing is housekeeping services and laundry. It's just like being in a hotel. You don't have to clean your room. You don't have to worry about doing your laundry, things like that. Food preparation. One great aspect is every nursing facility has a dietitian that's on staff, and the dietitian gets to know the patient, knows the likes, the dislikes, and also makes sure that they're eating a well-balanced nutritional diet. Because sometimes when you're home, you may have a piece of toast or a little bit of orange juice. Now you don't want to have lunch, and then if your loved one comes over at the end of the day, you'll have like a meal at the end. So at least you're getting 3 balanced meals and also snacks. A safe environment. Facilities are safe. Round-the-clock supervision. There's grab bars, there's low beds, there's different aspects in the facility that would keep your loved one safe. On-site healthcare. Obviously there's an RN on duty 24/7. Nurses' aides, LPNs. We have doctors that come in 3 to 4 times a week that are on site here in the facility. You're also able to go out for appointments. So if you have a primary cardiologist, a pulmonologist, an orthopedic surgeon, you can go to those appointments. We also have what we call consultants that come into the facility. So you have your audiologist, the optometrist, the dentist that comes in, and the podiatrist. So that is services that are provided while you're living at the facility. And the last thing is specialized healthcare. Like I said, a lot of facilities will specialize in wound care, orthopedics, cardiac, respiratory, and they have consultants that come in to the facility. It gives you a lot of structure to your daily care and your routine. I've been a nursing home administrator since 1997. Prior to that, I was a nurse since 1990. So I care about my patients. I care about every single person that walks in the door. I love it. I would not want to do anything else in my career. I love what I do, and we make sure that our residents are well cared for. The big question is, how do you pay for long-term care? So if you're transitioning from short-term rehab, you come from the hospital, stay for short-term rehab. The managed care companies will allow a certain amount of days. So if you come in for, I'm just gonna throw out a number, a hip replacement, a managed care insurance may say, we will cover the stay for 14 days. Then after 14 days, it's private that you would have to pay. So you would have to work with the insurance company for your short-term stay. If it turns into long-term care, some people think, oh, the managed care company is going to pay for the long-term care. They don't. Medicare also does not pay for long-term care. Medicare is not a payer of long-term. They pay for a short snippet of time. For short-term rehab, they pay 20 days, and then there's a copay of $194.50 on day 21 that is the responsibility of the patient or the family. And then if you have co-insurance, that would get covered, and that's a whole nother topic, right, Steve? So the payers for the skilled facility is private pay. It could be your long-term care insurance. You have to make sure your policy and what the policy covers. Some long-term healthcare insurance policies may pay only $100 a day, where the stay at the facility is $400 a day. So there's still that $300 out of pocket you have to pay. Private pay, obviously, most nursing homes are run anywhere between $14,000 and $15,000 a month. Title 19 really is the big payer for long-term care. That is something that you would work with an attorney or work with a social worker at the facility. You can have a prepaid burial account. I won't get into all the numbers with that, but you can work with an attorney for paying for a prepaid burial, but you can only have $1,600 in assets coming to a facility, and you will be granted Title 19. It is a process. The Title 19 is like a 35-page form that you have to fill out. I feel I'm a relatively intelligent person, but when I had to fill it out for my father, all my intelligence went out the door. I mean, you sit there and you have to have bank statements from 5 years. So they have to get a look back. So when you're thinking about long-term care, start preparing. Start getting your documents in order. Get the checking account, get the codes to the checking account, get your bank accounts, getting any trust or annuities, get everything lined up so that you have it. What I suggest is that you tour facilities. Don't go during the day, because there's so many staff there. Go in the evening time. Make an appointment on the weekend. Stop in on the weekends. It's not the beautiful piano that's going to take care of your loved one or this fancy chandelier hanging from the ceiling. It's the staff that's going to take care of your loved one. Are they smiling? Are they happy? Are the other patients that there, do they look happy? Are they smiling? Are they clean? Is their hair well groomed? Talk to your family and friends. Talk to people that have been at the facility. And also ask your doctor recommendations, because a lot of primary physicians are medical directors in skilled nursing facilities. Let's see. If you're coming from home, directly from home to a long-term care facility, it's not a quick process. You would have to go see your primary physician. Your primary physician has to fill out a W-10 and also what's called a PASSAR form. That has to get sent into the state of Connecticut. They have to review it, and then they approve your stay. And you have to have 2 to 3 activities of daily living that you need assistance with. So someone who comes in who needs help with bathing and dressing and toileting, they would qualify for skilled facility. Someone that does not need any help with activities of daily living would not qualify for a skilled facility. But if you have cognitive impairments, that would allow you to come into a facility if there's some sort of a dementia, Alzheimer's, like Deb was saying. Like I said, I've been a nursing home administrator since 1997. I fully enjoy what I do. There's a lot of facilities out there. I just encourage everyone, make tours, set them up, do your research, and put your loved one on a waiting list, because you don't want anything in crisis. I've had so many families that come in and say they want to admit their loved one that day, and we may not have a bed availability. The skilled facilities may not have an opening. So if you put your loved one on a waiting list, that's no commitment that you're ever gonna come there. You fill out a form, it gets sent into the nursing home, and every 4 months, the admissions director would give a call and say, hi, this is Janet, we're calling you on the waiting list, is your loved one ready? And you can say no, and then we go to the next person. But then someday when you're ready and you say, you know what, I'm ready now, you've already have an application in, so you're on the list. So many people come, with crisis, and it's not a good situation. You want a nice, smooth transition, because it is a hard decision to come and give up an independent lifestyle and come to a skilled facility. However, you thrive. Like I said before, people do not come to nursing homes to pass away. They come to nursing homes to live and enjoy life, make friends in the facility, and enjoy each other's company. So, thank you, everyone.
Thanks, Janet.
Thank you.
Now, Bernadette, as a geriatric care manager, your role is all-encompassing. So can you explain that and also fill in any of the gaps that we miss?
Yeah, I'm just going to say, I work with everybody at this table and then some. I always say I work with the world, because that's really true. People say, what do you do? I say, well, I do everything from ordering the snowplow to putting the pills in, and anything in between. So a geriatric care manager, it's a senior care professional specializing in senior care and all senior care issues. And I usually am hired by a family with the permission, of course, by the person who I'm going to be the care manager for, because maybe the family lives far away and they can't be there all the time for someone, but they're very caring about their loved one. Also, there are people who are very busy. They have jobs where they fly around literally all the time, and they can't be there for their loved one. And I also have people who just live right around me, even on the next block, who just don't know how to put things together. They just don't know how to organize things together, and they want somebody to help them to do that. So that's what I do. I do have a brochure that's out there that tells all the services that I provide. And I have an article from a newspaper that Gene Cherney wrote one time that explains it really well. What I do is when I get hired, so to speak, I go in and I do a complete assessment of the person, the home. I get information from all their doctors, from their churches, whatever. I get all kinds of information of who is this person and what does this person need. And then I write up a report that I give to family and to the person. Obviously, it's a report in movement, because things can change when you're aging, as you know, the next week. So I give that report saying that, and then I follow the case on an ongoing basis. Some people I see every week because that's what they need. Some people I see once a month. I try to see everybody at least once a month, so I'm up to snuff. I do a lot of phone calling, and I actually don't charge for that. I do phone calling for people, and phone and talk to them on the phone. I really bond with families a lot, so they tell me a lot about their people. I am the eyes and ears for the family members who can't be there. And I assess their medical, social, and living needs. And I also assess people like their friends, their church groups, their community, and coordinate all those services. I have a lady now who's 97 years old, lives in her home alone. She does have some help. She probably needs more, but it's a tough case. But she has a lot of wonderful people in her neighborhood that are support to her, and I know all of them. And they keep me posted too about what's going on, and I keep them posted, and she knows all this, and she's very happy with that. So I just support and manage and love all my clients who I have, and I watch them go through their process of aging. And one of the things that I do, and is why I work with a lot of these people, is that after a person is, or while the person is in their home, there might come a time where they either don't want to be in their home anymore because it's overwhelming, or they need not to be in their home because it's just plain unsafe. And it sometimes comes to that. And it comes to that sometimes even when people have help, because the help isn't enough. So, and some people just realize that they might be better off in a place where they could get more socialization, where they could, see other people. They could go on trips and they didn't have to hire a car, or they didn't have to drive themselves or whatever. And they'd like to get rid of their pots and pans and not cook anymore. So it's all those kinds of things I listen to, and I take all my clients who are interested many months before they do this to see places, as Janet talked about, planning. So I take them to visit places. We get a lot of lunches, and then I work with them. Make lists of things, pros and cons, and help people decide if that's what they're going to do, to make a choice of where they're going to go. My job is to keep people safe and comfortable and aging with dignity and care. So one of the types of places that was missing from this panel, which I would talk to a little bit, and I have actually these handouts for everybody I'll have them passed around. The type of place that was missing was a CCRC. Now, a CCRC, how many of you have ever heard of a CCRC? Oh, good, that's quite a few. All right. Well, for those of you who haven't, it's a continuing care retirement community. Now, you know what continuing means, so that means you go in at one level and you could move in every level of care without having to move. It's a full continuum of care on the same campus. In other words, you live in the same place. But normally, I think almost always, you have to buy into that community. So it's just like buying a home, really. And you have a fee. The average entrance fee, now I'm talking about sort of nationwide, so it could be more in Connecticut. The average payment to buy in is like $350,000. And then there are monthly fees that range from $3,000 to $5,000 per month. But don't forget, that encompasses everything. You're not going to pay taxes anymore. You're not going to pay for heating. You're not going to pay for anything else. And that's the same if you go to assisted living also. If you go to a CCRC, residents must meet physical and cognitive health requirements. Now, that doesn't mean they don't take people with some physical issues or cognitive issues, but your benefits may change a little bit. For example, if you already have been diagnosed with Alzheimer's, but you're like at a very high level, you may not get the same kind of benefit in their nursing home care as a person who comes in without any issues. And that, you'd have to ask more about that. Another way that this community is known is they call it a life plan community. So you're supposed to be able to be there for life. Now recently, well, I guess always, but recently more so, I'm finding, there's this great emphasis in CCRCs on hospitality, kind of like the Marriott. The amenities are a very rich lifestyle. Many of these places have exercise coaches and lovely physical fitness places, gourmet foods with meals at any times, many trips to cultural events and other events, very lovely cultural and intellectual offerings at the facility. They have clubs, even like garden clubs, reading clubs, all of those kind of things. Often the population is a little bit younger because people come with the idea that they're going to go through the rest of their life there. So one CCRC that I recently visited, for instance, is now building their own pickleball site because people are interested in that. So that's the kind of thing that happens. People entropy.
Can you clarify what a CCRC is? People might not know what that means.
She did
Oh, I
say.
did. Yeah, I did, yes. I did. Life planning or continuing care retirement community, yeah. People want to be as independent as possible, and CCRCs do stress that. They get whatever medical care they need there. They usually have a doctor right in place. They continue to live in their own apartments unless it's no longer possible. Many CCRCs have dementia units or dementia buildings, so they do a lot of times. But some don't, but they have programs then that go on throughout the day for dementia residents. If someone goes to a hospital because they have a medical issue, you don't have to go anyplace else for your rehab. You go right back to your place for the rehab because they have a long-term care skilled facility right there. That's part of the CCRC. The other great benefit, I think, is there's a lot of flexibility for people who have a spouse or a partner who might need a different kind of medical or personal care. I have a friend who came from San Francisco with her husband. She's living in a CCRC in Connecticut right now. He has pretty advanced Parkinson's, and she's perfectly fine. They're both living there. He goes to a Parkinson's group there. He uses the swimming pool, which is a great help. She can do anything, and she feels good about being able to go out even and do things because she feels he's well cared for even when she's not there. She found it very difficult in the home being the full-time caregiver, but he now has interesting things to do, and she has interesting things to do, and the stress is completely diminished. They have transportation there like they do in assisted living places too. So the idea is that there's stability in remaining in the same place that you call home throughout your life. But, you have to be very careful because, you have to ask the question, if you're 90 years old or 95, do you want to pay all that money to buy into a place? I mean, that's a big question. The payment types vary. There are all kinds of levels of payment plans in a CCRC. And you have to really go to them and find out. They'll give you everything in writing and give you a whole lesson on these payment plans. And what you pay depends really a lot of times on how much money you want left in your estate. If you don't care about any money being left in your estate, then you pay less by the month. So it's a good idea if you're interested into a CCRC to consult with your financial planner about the plan of payment and the cost. And they will go through everything with you. And it's also a really good idea, and a lot of people don't do this, to the best of your ability, if you can find out what the state of the CCRC is financially. Because if the CCRC is having trouble and they're diminishing their financial status, then you better be very careful about buying in or paying in, because that could be a big problem. For me, in Connecticut, you hear some of the CCRCs I know: Evergreen Woods in North Branford, Elam Park in Cheshire, Whitney Center in Hamden, Stone Ridge in Mystic, Pomperaug Woods in Southbury, Doncaster, I think, was the first in Bloomfield. Those are places I know well.
Essex Meadows.
What?
Essex Meadows.
Oh, Essex Meadows, that's right, there's Essex Meadows.
And then Benchmark has Edge Hill in Stamford.
Oh, okay. Well, I didn't know Benchmark had a CCRC.
We have 3, not only one in Connecticut.
And I would say that there's one other place I would mention. It's not a licensed CCRC, but Mary Wade in New Haven does have every level of care on the same campus because they just built a new assisted living building, and their entry is really programmed toward the middle class. So some things are a little bit less than other places, and it's a very good place. So that's CCRCs. I work with them. I work with assisted living. I work with the towers. My mother lived at the towers for 8.5 years. I work with real estate people. I work with home care people. I work with everybody and try to make it work and be like, I guess I would say I'm more like I become for people sort of like a surrogate daughter.
Thank you, Bernadette, and thank you, everybody. Wow, that was quite an education.
Yeah.
Yep. So I'd like to give you the opportunity to ask questions.
This is probably not a good question because it's so simple, but I just want to make sure that I understand. Basically, we're talking about 3 different levels of care throughout the presentation. Independent living, which generally you're providing your own food, you're just paying rent in effect.
Not necessarily at the towers. We have a cafe and a dining room, so we do offer meal plans
You do.
in our community. Yes,
But
we do.
independent living in general, you would have a kitchen and.
You have a full
fair
kitchen
say-
at the towers. You have a full kitchen in all of our apartments. We offer a full
Okay.
kitchen, but we also offer cafe and dining room if one chooses not to want to
Okay.
cook.
Assisted living is the level higher, I guess. I guess I'd call it higher. And that is, you're going to be provided meals. You're going to pay a monthly fee or whatever. You're going to get your meals as part of assisted living, right?
Well, the meals in assisted living are part of your rent. They're
Right.
not part of the care package. They would be part of your rent.
Right. And then, of course, ultimately, long-term care, which was described at the end, is much more expensive, obviously, and it is comprehensive. And then, of course, somewhere sprinkled in there is memory care, which I understand.
I just
So
want to
in
touch on independent living, that there are several different types of independent living.
Yeah.
Okay.
There's a couple communities in our area, and they do provide food. And then they also, I believe, have a little kitchen. But so every independent living community is a little bit different.
So the thing with independent living is that when you are in an independent living community, you might have a meal plan option. You might not. But the fact is that if you ever do need care, you'll be hiring your own personal care
Yes.
people.
Right.
There will not be anybody on site.
Well, except at the towers, we do, yes, contract assisted living services. We have a state licensed assisted living service agency on site that has an office on site, as well as partnering with a physical therapy and occupational therapy company that has an office on site, and with podiatrists coming to your apartment, audiologists coming to our community as well. So that's what makes us unique from other types
Correct.
of independent.
So I'm hearing that independent living has a lot of different flavors in effect.
Yes.
Okay. Thank you.
Any other questions?
Bernadette, how do you find out the state or financial status of a CCRC?
Of what?
A CCRC?
Oh, how do you find out? Financial status. Good question. Probably better, probably to ask them for their financial statement,
Okay.
yeah. And then maybe go to your own financial person to take a look at it.
Okay.
On the subject of CCRCs, when they decide how much you need to put up front depending on your age, I suppose, and your needs, right? Actuarially, they're looking at your overall situation for longevity. Is that fair to say?
No, it's just
No.
one time, you buy into it.
I think that there'll be different levels of buy-ins, though.
Yes.
The less you put down up front, the more you're going to monthly pay.
Right.
Oh, okay.
Yeah.
All right. Now, I know this is a little bizarre, but let's say you go in and put up your money and you live there for a couple months and then you die. All that money that you put up disappears?
No. Within the plan, there is a plan that some of that money will go to your estate, yeah. Part of that plan is the piece that goes to your estate.
So would that be a function of how long you
And that's the thing I was talking about. You pay differently if you don't care about too much money going into your state.
I think that I think that if you're working with a CCRC, oftentimes you're going to know when you go in that you're never going to recoup 10% of your investment. There'll be a percentage that they'll tell you. It's because they're not going to do it for free. They're not, even though they're going to give you your money. So if you paid $350,000, you lived there for 4 months, what happens is your estate is not going to realize the actual $350,000. There's going to be a percentage off that. But until they sell your apartment again, you will not see any of that money. Your apartment will have to be sold before you will get that, your estate gets that money.
In effect, they're like condominiums.
Well,
You have a legal right for use at a minimum, I assume.
well, your condominium you personally own. You know, the CCRC, you're purchasing that apartment knowing that you're aging in place, that if you have no more assets and you've spent down and now you're in their skilled nursing home, that's really what that's protecting you with. You've spent $350,000, you're paying your monthly fee. You've run out of your monthly fee, but now you're in their health care center. You'll stay there until you pass away. But there'll be no sale left because you would have used all of your equity that you had invested in that apartment.
You had a question.
Kind of answered that. So you could outlive, if you lived to be 100, and the actuary, based on whatever kind of thing, didn't think you would. So you go through all your assets and whatnot, and they are obligated to provide whatever level of care that you need, right?
Correct.
Until the day you die.
Correct.
No matter what it entails.
Yes.
But they try hard not to make that happen.
Yeah.
Yes.
Do you have any information on the veterans?
I have a flyer that I could send to you, the Veteran Aid and Attendance. I have a link that I could send you if you have an email address you want to share. No? Okay, then I have a flyer that I can probably dig up before you leave today.
Because somebody mentioned something that, about the VA and then their spouse.
So it's not the VA, it's the Veteran Aid and Attendance. It's a government, U.S. government. The VA locally has nothing to do with it. It is the U.S. government that is providing a subsidy for someone who needs assistance with their activities of daily living. You can't be perfectly healthy and try to get this stipend. It's when you need in-home services, whether it's at a facility or in your own personal home, you will then be able to apply for this.
Okay.
Does that have it? No. Oh, you're listening.
And just to let you know regarding the VA too, in the state of Connecticut, they separate it. In our area, there's a representative that you could actually call and talk to about the specific benefits and.
It's in Milford. I know there's one in Milford.
Yeah, and some of us have brochures.
She has the numbers then?
We could definitely.
I just have an 800 number
Make sure you
to
fill
call.
out, everyone fill out their forms, but fill out your forms and I'll star it and we can email you
Or mail it. I'll try to get you. I don't know exactly where they are. I might have to print one out for you.
Okay.
So.
Yes.
In the little vignette about Carolyn and Bill, and he quitclaimed the house to her as he was beginning to fail.
That's over here.
If the house, I'm sorry, it was over there.
Yeah.
I apologize. If the house were sold before the quit claim, et cetera, would all of those resources be available for the spend down? Or is that
It depends on how long before the quit claim had happened. In his case, there was enough time had elapsed that it wasn't, the asset of the house was not still held against him, if you will, for him to get onto his Title 19.
And is that 5-year look back period?
Yes.
Is it only 5?
It was 7.
I thought it was 7.
now?
It might be 7.
When my father was on it, it was 5, so.
Okay.
Okay.
It's 5.
Is it 5?
Yeah.
Okay.
Janet just said.
It's still 5. Hurry up.
It's a 5-year.
They're talking about making it 7 years.
Okay.
Yeah.
A 7-year look back.
They've been doing that for 10 years now.
Go ahead.
What if you have a trust? Can the nursing homes attach your trust?
So if you have a trust, I would suggest getting an attorney, and the attorney would actually work with you for the trust, and the trust could pay for the nursing home room and board, yes. definitely.
But the money would come out of your trust?
It
then?
would come out of your
Yes.
trust, yes.
But you need to know if it's revocable or irrevocable, so you definitely need to talk to an attorney.
Any other?
There are ways that the attorney can safeguard your assets.
Yes.
and Such, not all attorneys are well versed on it, but there are ways.
If you're gonna use an attorney, I would highly suggest you use an elder care attorney. Just like we were talking about primary care doctors not knowing things, I can't tell you the amount of times people have come to me with stuff their attorneys said that is just totally false. So you really need to use an elder care attorney who just makes sure it's their business to know all the ins and outs and changing rules and all of that, so.
Along with that, does your organization recommend any particular elder care attorneys?
We have a list.
You do? Okay.
Yeah.
Where do you actually live?
I actually
On the
do.
website?
Where do you actually live?
Brantford.
In Brantford, okay.
Is there one attorney there that would?
There's a couple of attorneys. I mean, do we have it on our list that we're handing out?
Services page, everyone's on the services page.
Okay.
On the website.
It's on our website.
We don't have an internet.
Okay, I know Joan Reed Wilson, but she's moved out of the area.
Middletown.
Yeah, she's in Middletown now. Joan Reed Wilson, she used to be on the Shoreline.
She still has a Clinton office.
Does she?
I mean, you could give us your address and we could mail.
If you fill that out, we'll mark it.
We'll mail you something.
Steve, did you want to say something about our next presentation?
Where's that located?
We have more questions.
Oh, sorry.
Oh, wait, go ahead.
If you're still independent enough to do things like traveling, or let's say have a vacation home somewhere, is there flexibility in the monthly fees or in the meal plans in CCRCs or in assisted living to take into account the kind of change you might have for a month or two or even 3 during a year, rather than pay what are the higher fees?
So
during that?
you're always going to be responsible for your rent. And your rent in an assisted living. And the rent does include your meal. I think that they maybe in 1 year would do a 30-day meal credit. That might be it. But you're still going to be responsible. However, if you have a care plan and you're going to be going on vacation and wherever you're going, and Florida has, you're going to have somebody else doing your care, you would only pay for the first 7 days you were out of the community, and then we would no longer charge any service plan until you return.
That's the care plan.
Yep, or med management, but rent, yeah.
And what about CCRCs?
I'm not sure. I think you have to ask down.
I doubt it.
can find out, but I can find out for you. But I know there's I see a lot of people on CCRCs that go away,
Yeah.
and they do have the benefit of their meal plan being extended. So, but I don't know about the rent.
Okay.
I don't know. I'll
If
get
someone
that.
is, I'm sorry.
Go ahead.
If somebody is hospitalized under that circumstance, do they continue to pay for that first 7 days?
They pay for the first 7 days, and they pay their rent the entire time they aren't here, but their service plan would be discontinued on day 8 until they return back to the community. That's for Benchmark. I can't speak for other facilities.
Thank you.
Somebody else have a question? Yes.
I thought there were some people back there raising their hand. I'm confused about the difference between skilled nursing facility, long-term care, nursing home. Is there still something called a nursing home?
It's
anybody still-
all the same. Skilled nursing facility is long-term care, is a nursing facility. It's all the same facility. So a skilled nursing facility provides you long-term care.
Okay, well, what's it called then when you've been in the hospital and you only need short-term rehab?
Right, so most nursing homes have units that are just dedicated for short-term rehab. So take, for instance, my facility is 190 beds. I have one unit that's 30 beds that's just dedicated for people that go to the hospital and need to come for physical therapy, occupational therapy, speech, respiratory, and they need to have a doctor see them 3 or 4 times a week and intense nursing care. That is a unit that's on in a skilled nursing facility.
And that Medicare will pay for.
They will pay for the first 20 days, 100% of your stay. And then on day
Providing you're improving.
Right, you have to be making gains and improving, and then on day 21, there's a copay of $194.50 a day. But if you have a supplemental insurance, that can pick up that.
And that's the only one that Medicare pays for.
Yes.
Thank you.
Sure.
Anyone else?
In an assisted living community, your Medicare will cover any therapies that you need, as well as your private. So say you moved into an assisted living community and somebody did an evaluation, and for safety's sake, they wanted to make sure you understood how to properly use the shower, use the grab bars. All of that would be covered under your Medicare. So you do have an initial situation. Even if you were at a skilled nursing facility and you were discharged after being in short-term for rehab, if you went to an assisted living or even to your home, Medicare will cover some additional support in your home, whether it's in your personal home or at a community.
And that's true in every home.
Right.
I mean, the CCRCs or home care,
Right.
or assisted living, they all become your home. They're all your home.
Right.
So Medicare pays for those kind of services that you need.
Right.
Thank you. Bernadette, when is our next presentation?
I don't have, do you remember the date? I think it's December.
I don't have my phone.
We're so focused
I
on
actually
this.
think it's December 13th. It might be the 12th. It's a Sunday, either the 12th or 13th. And it's going to be at the Community Soup Kitchen, which is in Brantford. And we're doing a whole thing on nutrition. And we have a wonderful presenter who is actually a chef that goes around to senior homes.
Her name is Nikki Satin.
Nikki Satin is her name.
Chefs for Seniors is her business.
And she's very, very good. And I just will give you a little story. I have a good friend, actually, who's an elder care attorney, and her husband was kind of down and out with some medical issues, and she works very hard and many hours, so she had Nikki Satin come to her house and be her chef, coming and going with meals, and she thought she was superb, excellent. It was of excellent help. So it's usually used for temporary basis. Not you don't have a chef forever, but she can come and help when time is needed. So she's going to be the presenter.
I'd like to say thank you for everyone for coming. I'd like to thank Pam for orchestrating and moderating everything, and thank everybody for their presentations.